sign. It's tested for hypoglycemia, which is low calcium in the bloodstream. So what you're going to do is you're going to tap the facial nerve here, right here for this side purposes. You're going to tap here, and you're looking for some muscle twitches and facial twitches in the face, which he's not saying, so that's negative, but those facial twitches would be positive for hypoglycemia. Okay, the next test we're going to do is Romberg's test. It's another test for balance, testing vestibular. We'll do this for concussion eval or any other cranial nerve kind of test we would do. So I'm going to have you stand up for me. Okay, I'm going to have you stick your hands out to the T shape. Close your eyes, stand on one leg, and and tilt your head backwards, like you're looking at the sky. I'm looking for any gross unbalance like that, and I'm standing here to support him. And that would be a positive sign for some vestibular problems. Obviously, he just has poor balance, and that's what that's testing for. Alright, so the next test is the Oppenheim test. This is for upper motor neuron lesion, as we saw in the previous test. So I'm going to sit back on the table for me, all the way back if you could, sir. Appreciate it. Remove the sock once again. Okay, in here, I'm going to rub it down the length of the medial shin. I'm looking for the great toe to extend and the toes to sprawl out. His are not, so he is negative for an upper motor neuron lesion. We may see this in athletes with a nerve injury, nerve impingement, or maybe concussion if there is the problem there. Okay, this test is Allen's test. It's another test for thoracic outlet syndrome. So what I'm going to do, I have the elbow flexed at 90, shoulder here. I'm going to externally rotate. Feel that dorsal pubis, and I'm going to have you push your shoulder tilted that direction if you could. Not tilted, like twist it. Okay, and look that way. And I'm looking for any dissipating radial pulse, or if it's abnormal in any way, and I'm going to compare that bilaterally. So this hand. Good. And you look that way. Perfect. And again, if he has a diminished or different or abnormal radial pulse, then he is positive for thoracic outlet syndrome, but he is a negative for that. Okay, this is another test for thoracic outlet syndrome. It's called the Bruce test. You're gonna have it like you're lifting a bar off your shoulders real quick, like that. You're gonna open your hands, and you're just gonna go like this. Okay. Now the athlete, we would do this test for 3 minutes. Obviously, I'm not gonna do it for 3 minutes. But a positive sign is if he was doing this test and halfway through his arms drop, he's not able to maintain it, or he gets some tingling sensations in his hand or his wrists, and that's positive for thoracic outlet syndrome. But I'll just let you stop now. I'm positive he's negative since he hasn't been positive in the other thoracic outlet syndrome tests. That's the Ruse test. Okay, and for the last test, we're going to do the upper limb tension test. This test for nerve impingement, and it's positive if they have a restricted range of motion. So I'm going to have you put your feet at that end and your head at this end of the table. I'm going to have your head resting on the table. There we go. Okay, so there's 6 steps. So the first step, you're going to put pressure on the glenohumeral joint. And the second step, you're going to abduct the shoulder at 110 degrees. And the third step, extend the wrist and the fingers. So extend your fingers back for me. Perfect. And the next step, you're going to externally rotate the elbow like that. And then the 5th step, you're going to lift the shoulder above the head while keep pressing on the glenohumeral joint. And then the 6th step, you're going to tilt your head to the left. You're looking for any pain or restricted range of motion in that, and any of those would be positive for a nerve impingement, but he was negative on all 6 steps of the test.